Angelica Welcome to Spurbs Herbs, episode 89. Today we are going to be talking about a Chinese herb, Qiāng or Notopterygi. I like saying that word. I don't know. Notopterygi or Rhizoma Radix, which means rhizome or root. And the common name is Notopterygium root or rhizome. You can do that as well. Today, we will be exploring another interesting Chinese herb. We just went over all at Qiāng. This herb is in the Chinese medical subcategory of warm, acrid herbs that release the exterior under the category of release the exterior herbs. It is helpful for certain types of colds and especially for alleviating pain and unblocking painful obstructions in many conditions, such as some types of arthritis. And as usual, we will be exploring something a little different. We're going to discuss the very common condition of arthritis. If it helps arthritis, why don't we talk about arthritis? So we're gonna. Please join us for this intriguing episode. Before we get into this, I just wanted to remind you that I have been teaching for quite a while now on a wide variety of topics. If you like this podcast and want to explore more of my courses, they are available at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org, and include a ton of different topics, including my drug herb series, looking at drugs and how they interact with herbs and vice versa, several ethics and safety courses, Chinese medical research, several treatment of condition courses such as arthritis, neck and back pain, COVID, and depression and anxiety, and one of my favorite courses, the Chinese Herbal First Aid Kit. And they are all at reasonable cost, full stop, they're at reasonable cost, but you can get an additional 20% off with the code SH20OFF, that's SH as in Spurbs Herbs 20 off, and that is huge because they're already reasonably priced. All right. Today we're going to be talking about an herb which is one of several Chinese medicinals used to treat arthritis. A brief introduction to arthritis was warranted, and since I have a course treating arthritis with Chinese medicine, here's the introduction to that course, modified, of course. Of course. According to Mayo Clinic, arthritis is the swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness. It can also refer to an infection of a joint. And there are two common types of arthritis, osteoarthritis and rheumatoid arthritis. We're going to get into both of those. And many less common forms, including ankylosing spondylitis, gout, juvenile idiopathic arthritis, psoriatic arthritis. People with psoriasis can get arthritis, that's psoriatic arthritis, reactive arthritis, infectious arthritis, and septic arthritis. So lots of arthritis. We're just going to talk about osteoarthritis and rheumatoid arthritis right now. So what is osteoarthritis? Osteoarthritis, OA, also known as degenerative joint disease or DJD, is a chronic arthropathy, which means pathology of the joint, characterized by disruption and potential loss of joint cartilage, along with other joint changes, including bone hypertrophy. That's overgrowth of the bone. In this case, osteophyte formation. So osteophytes are the little formations. So when tendons kind of pull on the bones, they can bone spurs. Osteophytes are bone spurs. There we go. That's an easy way of saying it. So osteophytes are bone spurs. It is the most common joint disorder, often becomes symptomatic in the 40s and 50s, and is nearly universal, although not always symptomatic, by age 80. Only half the patients with pathologic changes of OA have symptoms. So half the people don't have symptoms, half the people do. Of course, we see a lot of them in our practices usually. Below age 40, most large joint OA, osteoarthritis, occurs in men and often results from trauma or anatomic variation, for example, hip dysplasias. Women predominate from age 40 to 70, after which men and women are equally affected. Signs and symptoms include gradually developing pain, aggravated or triggered by activity, stiffness lasting less than 30 minutes on awakening and after inactivity, and occasional joint swelling. Normally, joints have little friction and do not wear out with typical use or overuse or most trauma. More often than not, an initial trigger for osteoarthritis is not known. However, it can begin with a mechanical injury, inflammation, or defects in cartilage metabolism. Obesity can actually involve several of these initiating factors, so that is considered a pretty high risk factor for osteoarthritis. Chondrocytes, which are cells of cartilage cells, are involved in the repair of cartilage, but also break down cartilage, which can be exacerbated when inflammation is present. Eventually, several articular and periarticular, so that's articular is the joint, and periarticular around the joint changes occur. Subchondral bone stiffens, so bone underneath the cartilage stiffens, then undergoes infarction, which is lack of oxygen, and develops subchondral cysts. So cysts can form there. Those are little holes, basically. Attempts at bony repair cause subchondral sclerosis or scarring, and osteophytes at the joint margins. Remember, osteophytes are bone spurs. The osteophytes seem to develop in an attempt to stabilize the joint. The synovium, which is the fluid in the joint, becomes inflamed and thickened and produces synovial fluid with less viscosity and greater volume. So it becomes bigger and less viscous, so it's more fluid. Periarticular, so these are around the joint tendons, and ligaments become stressed, resulting in tendinitis and contracture. So tendinitis is inflammation of the tendons, and contracture, so they can, to protect itself, they will contract. As the joint becomes less mobile, surrounding muscles thin and become less supportive. Menisci fissure and may fragment. So menisci are the cushions in the joints that are made up of cartilage. So menisci will fissure, they will split, and may fragment. That often happens in the knee, very common in the knee. Onset of osteoarthritis is usually gradual, beginning with one or a few joints. Pain, sometimes described as deep and achy, is the earliest symptom. This is usually worsened by weight and relieved by rest, but can become constant. As it progresses, joint range of motion becomes restricted, and crepitus may develop. Crepitus are the little cracks and creaks that you get when you move a joint. They can also be felt, not just heard. Development and remodeling of cartilage, bone, ligament, tendon capsules, and synovium, along with varying amounts of joint effusion, which is fluid in the joint, cause the joint enlargement characteristic of osteoarthritis. And that's a brief overview of osteoarthritis. Let's talk about rheumatoid arthritis. So rheumatoid arthritis is a chronic systemic autoimmune disease that primarily involves the joints. RA, rheumatoid arthritis, causes damage mediated by cytokines, chemokines, and metalloproteases. These are all parts of the immune system. These are all different chemicals of the immune system. Characteristically, peripheral joints, for example, wrists and metacarpophalangeal joints, those are the joints between the wrist and the fingers, are symmetrically inflamed. So these are between, they become inflamed, but side by side, so the left side and the right side, symmetrically inflamed, leading to progressive destruction of articular structures, so joint structures, usually accompanied by systemic symptoms. This is key. Rheumatoid arthritis is a systemic disease that affects our joints. That is different from osteoarthritis, which is a joint disease and does not affect us systemically. Rheumatoid arthritis affects about 1% of the population, and women are affected 2 to 3 times more often than men. Onset may be at any age, most often between 35 years and 50 years, but can be during childhood or old age. Although rheumatoid arthritis involves autoimmune reactions, the precise cause is unknown, and many factors may contribute. A genetic predisposition has been identified. Unknown or unconfirmed environmental factors, for example, viral infections, cigarette smoking, are thought to play a role in triggering and maintaining joint inflammation. Rheumatoid arthritis is characterized by synovial inflammation. Remember, the synovium is the fluid in the joint, and hyperplasia or swelling. Autoantibody production. So these are antibodies, as we know, are part of our immune system that attack things that are invading the body. Autoantibodies are things that are attacking parts of the body. So that's part of an autoimmune system reaction. And these antibody production include rheumatoid factor and anti-citrulline protein antibody, or ACPA, cartilage and bone destruction or deformity, and systemic features including cardiovascular, pulmonary, psychological, and skeletal disorders. So it can affect large amounts of the body. The signs and symptoms of this disease are numerous and often systemic. They usually start slowly and insidiously with signs and symptoms including early morning stiffness of the affected joints, generalized afternoon fatigue and malaise, anorexia or loss of appetite, generalized weakness, and occasionally low-grade fever. Joint symptoms include pain, swelling, and stiffness. Sometimes initiation may be rapid and abrupt, looking like an acute viral infection. This can progress rapidly, especially in the first year and into the first 6 years. Within 10 years, 80% of patients will develop permanent joint abnormalities. Individual disease progression is highly individualistic and not predictable. What often sets RA apart from other joint disorders is the joints being affected symmetrically. That is key to RA. These joint signs and symptoms typically include stiffness lasts greater than 60 minutes after rising in the morning, but may occur after any prolonged inactivity. Involved joints may become tender with erythema or redness, warmth, swelling, and limitation of motion. Those are all the cardinal signs of inflammation. So redness, warmth, redness, heat, swelling, limitation of motion, and pain. Joints usually involved include the wrists and the index, second, and middle, third metacarpal phalangeal joints are most commonly involved. Proximal interphalangeal joints, the pips. So these are if you look at your fingers, you have the dip is the first joint, is the last joint on the finger, and the pip, the proximal interphalangeal joint, is the second joint on the finger. And so the pips can be the proximal interphalangeal joints can be involved. Metatarsophalangeal joints, those are in your foot, shoulders, elbows, hips, knees, and ankles. Basically, any joint can be involved except for the distal interphalangeal dip joints. That's the last joint on your finger. Those are not involved in rheumatoid arthritis. So that's really interesting. With the exception of the upper cervical spine, the axial skeleton is rarely involved. So is rarely affected. So the upper cervical spine may have some rheumatoid arthritis, though often that's OA as well. But the axial skeleton, the rest of the spine and the ribs and everything are rarely affected by rheumatoid arthritis. Fixed joint deformities can rapidly develop, and these include flexion contractures. In other words, you flex the fingers and you can't unflex them. Ulnar deviation of the fingers with an ulnar slippage of the extensor tendons off the metacarpal phalangeal joint. So what that actually means, so ulnar deviation, so the ulnar direction is towards your pinky. And what that can mean is that ulnar deviation of the finger, so all of them are kind of deviating a little bit towards that side, and the tendons can kind of flip off to that side as well. Joint instability due to stretching of the joint capsule can occur. And then there are some specific deformities that can occur. One is called the swan neck deformity. And this includes hyperextension of the proximal interphalangeal joint, the pip joint. So remember, if you're looking at your fingertips, it's the second joint on your finger. That's the pip. So that's extended, hyperextended. And then the dip joint, which is the last joint on your finger, is flexed. And sometimes there's flexion of the metacarpal phalangeal joint, the MCP, which is going to be the big knuckle there at the base of your finger is your MCP, metacarpal phalangeal joint. So that can be flexed. The pip is extended and the dip is flexed again. That's called a swan neck deformity. And if you can see the slides, which most of you can't, there's a picture of that. And then we also have another common deformity. It's called the boutonniere deformity. And this includes kind of the opposite. So it's flexion of the pip joint rather than extension, accompanied by hyperextension of the distal, the dip joint, the hyperextension of the distal interphalangeal joint. So that's the first joint from the end of the finger is extended and the second joint is flexed. So normally we can't do that. So I'm trying to demonstrate it, but I can't do it even with my thing. But I have, again, a picture. Okay. Carpal tunnel syndrome can result from wrist synovitis, which is inflammation of the synovial fluid, compressing the median nerve. And also popliteal or Baker cysts can develop. These are around the knee. The popliteal area is behind the knee. Those are actually relatively common kinds of cysts. Additionally, many systemic or extra-articular signs and symptoms can occur. So remember, extra-articular means outside of the joint. Subcutaneous rheumatoid nodules can occur in 30% of patients, and they are exactly what they sound like. They're little nodules under the skin. Subcutaneous means under the skin. Visceral nodules, which are on the organs, can occur in severe rheumatoid arthritis. Vasculitis or inflammation of the vasculature causes leg ulcers or mononeuritis multiplex, which is a very specific kind of disease. Wouldn't worry about it too much. So systemic signs and symptoms can also include pleural or pericardial effusions, which can be life-threatening. This is fluid around the heart in the pericardium. Pulmonary infiltrates or fibrosis. So fibrosis of the lungs is actually a very serious condition. That's basically scarring of the lungs, very serious. Pericarditis, that's inflammation of the pericardium. Myocarditis, that's inflammation of the heart. Lymphadenopathy, which is lymph node pathologies. Felty syndrome, and that's an interesting, is usually described as associated with as a complication of rheumatoid arthritis. It's defined by the presence of three conditions: rheumatoid arthritis, enlarged spleen, so splenomegaly, and a low white blood cell count or neutropenia. So that is Felty syndrome. Jorgen syndrome, which if you're reading this, it's SJO with the umlauts on it, GREN, Jorgen syndrome, and that is an autoimmune disease of dryness. Usually there's a lot of dryness with that, dry mouth, dry mucous membranes, things along those lines. Scleromalacia performans and episcleritis. So those are good stuff. So episcleritis is around, actually all of this. So let's go with scleromalacia performans is a rare severe eye disorder developing an autoimmune damage of the episclera, so around the scleras, that's the white part of the eye, and scleral performing vessels. So it is an autoimmune type disease. And episcleritis is inflammation around the sclera as well. And then finally, involvement of the cervical spine can cause atlantoaxial subluxation and spinal cord compression, which can be very serious. But atlantoaxial, the first two vertebrae, C1 and C2 at the very top of the head, one you can't feel. One's actually in the skull. You can't feel it. Usually the first vertebrae you can feel underneath the skull is the atlantis, and the one on top of that is the axial. So atlantis and axial vertebrae, and those can sublux, those can shift off where they should be and cause spinal cord compression, which if severe enough can be quite almost, debilitating. It can be extremely, almost entirely debilitating. So very serious there. And that is our introduction to arthritis, both of our arthritis. That's quite an introduction to those. So anything we can do to help these things, they're very painful. I don't know about you, if you have a practice. In my practice, I see a lot of OA, some RA, but a lot of OA. Well, 50% of the people have it. So very common. So anything we can do to help with arthritis is going to be useful. And one of the herbs I do use frequently in treating arthritis, or adding into other, if they have other conditions, I might add it in if they have arthritis, is today's herb. And today's herb is, we've talk about is Qiang, Notopterygii Rhizoma su Radix. And it comes from the family Apiaceae. And the standard species, there's actually several standard species here. We have Notopterygium incisum Ting X HT Qiang. So again, those I'll refer to the botanist. And this is Qiang. When we say Qiang, we are usually talking about Notopterygium incisum. But there are other completely valid substitutes for this. One of them is Notopterygium Forbesii, Borns, and that's Chuanye Qiang, and Notopterygium franchetii, Boyce, which is Chuan Qiang. So, and we're actually going to find out Chuan Qiang is considered probably the best of these. And so, the standard one is the incisum, but there's other ones that it can be as well. The medicinal part is the root and the rhizome. Other names for this are incised Notopterygium, Forbes Notopterygium, Qiang, we're spelling it Qiang, which is the pinyin and is the correct way to spell it at this point. But in older days, they used to use Wade Giles as a way to put it into Latin characters, and that is CH rather than Q. And so sometimes you'll see Qiang, exact same herb, but with the CH rather than the Q. Like I said, the Q is correct. The CH is no longer correct. For a while there, mainland China was pinyin, which would have been the Q, and Taiwan was Wade Giles, which would have been the CH. But about 10 years ago, Taiwan went to pinyin. So the CH is wholly wrong. You'll still see it. There's still older names for it, but it is not the correct. It should be Q at this point. Other names include Xian Qiang. I'm going to explain what those are. Da To Qiang, Zhu Jie Qiang, Chuan Qiang Huo, Shi Chuan Qiang Huo, and in Japanese, Kyokatsu, and in Korean, Kangwa. Kangwa. It has an L here, but I wonder if that was a miscopy and it should be an I. So, anyways, let's talk about the Apiaceae family. The Apiaceae family is the parsley or carrot family and includes edible plants and spices such as the carrot and parsnip, anise, celery, chervil, coriander, caraway, cumin, dill, and fennel. Poisonous hemlock is also a member of this family. There are about 34 genera. Elpool actually says there are about 300 genera, so that's 10 times difference. I don't know which is correct. And 3,700 species. They have hollow stems, tap roots, and flat-topped flower clusters known as umbels. A previous name for this family was the umbelliferae, referring to these umbels, which is where the stems of the flower cluster radiate from a single point at the end of the stalk, kind of like an umbrella. So getting back to Qiang, Bensky, and so remember we have quite a few texts that we look at, but three main ones. We're going to talk about all three of them right now. So Bensky and his team is one of them, and they say the dosage of this herb is 3 to 9 grams. Chen is their second text, and they say 3 to 10 grams with a maximum of 30 grams. And Brandon Wiseman is their third textbook, which say the dose is 3 to 12 grams for this herb. So they're all in the ballpark of each other. The category, according to Bensky, as we've mentioned, Bensky and his team put this herb in the warm, acrid herbs that release the exterior subcategory under herbs that release the exterior. Chen say it is a wind-cold releasing herbs subcategory under the exterior releasing herbs category. And Brandon Wiseman say it is a warm, acrid, exterior resolving medicinal under the exterior resolving medicinals category. So they're all saying the same thing. There may be some slight differences in how they translate and their perspective, but there's no discrepancy about which category these should be under. We've had herbs where there's been discrepancies. Bensky says it is acrid, bitter, aromatic, and warm, and enters the bladder and kidney channels, while neither Chen or Brandon Wiseman include the aromatic properties. So they say they agree with everything except the aromatic portion of it. History. Both Bensky et al. And Chen say the original source for this herb is the Shendong Bensao Jing, or the Divine Husbandman's Classic of the Materia Medica in the 2nd century CE. Having said this, finding this herb in my translation of the Shendong Bensao Jing was difficult. There were a couple mentions in footnotes to this herb in combination with other herbs, though these do not appear to be part of the original text. The only other mention after word search through an electronic version of the text was an alternate name for Baijur or Angelica dehurica radix. So this original sourcing seems both correct and incorrect. And I'm going to explain this in just a little bit. So hang on. When we get into the commentary of this herb, this is explained. So we're gonna see why this is a little interesting. All right, we'll get there. All right, so let's talk about herbs that release the exterior as a category. We've done this several times now, but I repeat that. So we've discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs, and we'll repeat that information here just in terms of completeness. So according to Bensky and his team, exterior releasing herbs are those that release disorders lodged in the very superficial levels of the body. When external pathogenic factors, including wind heat, wind cold, wind dampness, and summer heat, invade the body, they first attack its superficial exterior aspects. Symptoms associated with the exterior then appear: chills, fever, headache, stiff neck, and general muscle aches. Sometimes sweating will appear, which resolves the condition, in which case no treatment is necessary. At other times, however, there will be an absence of sweating, or even though there is sweating, it is not accompanied by any change in the condition. At this juncture, herbs that release the exterior are used. Most exterior releasing herbs are diaphoretics. That is, they release or expel the external pathogenic influences through sweating. There's a saying in Chinese medicine: when the disease is in the skin, sweating will bring it out. When a disease progresses slightly further in the body, it is said to lodge in the muscle layer. The clinical presentation then includes fever, general body aches, and profuse sweating. At this stage, especially when the patient has sweated without any beneficial change in their condition, it is appropriate to use the subset of herbs that release the muscle layer. The most prominent member of this group is Cinnamomum ramulus or Guizhi. Some of the herbs that release the exterior have additional functions: stopping coughs and wheezing, controlling pain or spasms, and venting rashes such as measles. So that was the herbs that release the exterior. And then there's the subgroup warm acrid herbs that release the exterior. And there's a short blurb here. Bensky et al. Continues to discuss the subcategory of warm acrid herbs that release the exterior. Herbs that release the exterior can be further divided by character and function into warm acrid and cool acrid classes. The warm acrid herbs dispel wind cold and are used for exterior disorders when the fever is mild, the chills severe, and there are other signs and symptoms of wind cold, including headache, body and neck pains, and absence of thirst. So what is good quality Notopterygium? Bensky and his team say the best quality is Sichuan Notopterygium. That's that Chuan Qiāng that we mentioned earlier, with short inner nodes forming dense annulations like a silkworm. It is also called silkworm Notopterygium or Zan Qiāng. That's C-A-N Qiāng. The surface should be coarse and dark brown, the roots aromatic, and a cross-section will show many oily brown dots. Chinese Medicinal Identification and Illustrated Approach, which is a great book for looking at, what is good quality herbs, says qiāng are cylindrical, slightly curved, with stem scars at the apex. Externally brown, the outer skin easily falls off to reveal a yellow color. Its texture is brittle and easily broken and light in substance, with a fragrant odor and a slightly bitter and acrid taste. Still in that book, according to traditional experience, superior medicinal material is thick and has brown outer skin and abundant oil spots on the fractured surface, as well as a potent aroma. Cinnabar spots, which are classic with qiāng, are brown or yellowish orange oil spots seen on the cross-cut Qiang. Those are called cinnabar spots. This is one of the things I love about this book in particular is it has these very sort of obscure names that unless you're doing really serious Chinese herbal assessments, you won't know these terms. And they're Chinese terms. This is obviously an English translation of a Chinese term, but cinnabar spots, I love it. Chinese medical action. So according to Bensky and his team, Qiang releases the exterior and disperses cold. For exterior cold patterns with such symptoms as chills, fever, headache, body aches, and pains. Most commonly used when accompanied by dampness with joint pain, a general feeling of heaviness, sleepiness, or when there is pain in the occipital region. That's the back of the skull. It unblocks painful obstruction and alleviates pain. For wind, cold, damp, painful obstruction, especially in the upper limbs and back. So this brings things up. It's often paired with, this is Qiang, it's often paired with Du Huo, which brings things down. So together they're called the two Huos, and it relieves body pains of all over the body. And finally, and this is where it goes, it guides qi to the greater yang channel and governing vessel to direct other herbs in a prescription to the areas served by these two channels. Chen say it releases the exterior and dispels cold, and it eliminates wind, cold, and dampness to relieve pain. So there's a lot of the pain stuff in this. Brandon Wiseman say it disperses wind, cold, and dispels wind, damp, and relieves pain. So almost the exact same thing. And Chinese medicinal identification illustrated approach say it scatters cold, dispels wind, eliminates dampness, and relieves pain. So that, yeah, it's good. Preparations. Bensky and his team does not discuss particular preparations of this herb and says this herb has a strong acrid aroma, which is the vehicle for its therapeutic effect. Because frying would greatly reduce this aroma, it is always used clinically in its unprepared form. So that explains why there aren't any preparations in particular, because usually Bensky will have several different preparations, but here it's saying clearly, like any preparations are going to destroy its function. So we don't. This is unprepared, always used unprepared. Western uses of this herb. It appears this herb is primarily a Chinese herb, and a web search yielded no traditional Western uses. The PDR for herbal medicines likewise does not mention this herb. That's a pretty comprehensive text. It doesn't have this herb at all in it. Qiang commentary. So this is commentary. Bensky et al., as usual, has an excellent commentary on this herb. Acrid, bitter, and warm, the clear, strong aroma of Qiang has a powerful dispersing quality that can strongly raise and discharge wind, cold, or damp pathogens in the exterior. Entering the qi level of the greater yang bladder channel, it releases the superficial muscle layer from exterior wind, cold, and cold dampness with such symptoms as headache, stiff neck, and sore shoulders. As it enters the qi level of the liver and kidney channels, it vents and eases the joints and is excellent for alleviating deep pain by removing wind dampness and wind cold dampness from between the sinews and bones. For these reasons, it is a commonly used herb for painful obstruction, especially in the upper body. Essentials of the Materia Medica, or the Ben Sao Bei Yao, written in 1664, observes that Qiang is most appropriate for governing vessel disorders involving muscular tetany or Jing, when there is damage from wind without sweating, it is called hard muscular tetany. With sweating, it is called soft tetany. There's also blood deficiency tetany, and generally both Qiang and Angelica pubescentes, Radix, or Du Huo are appropriate for wind disorders, but are forbidden for blood deficiency tetany. Treasury of Words on the Materia Medica, or the Ben Sao Hui Yan, written in the Ming Dynasty sometime between 1368 and 1644, explains the use of the acrid dispersing property of Qiang for sores and boils as using its ability to expel pus and draw toxins bring lesions to a head, and regenerate tissues. So that's the commentary on Qiang. And actually, we're going to get up. I said it was under the commentary. It must be under something else that explains why this. There's some confusion with the Shandong Ben Sojing. Okay, so Chen has an interesting commentary on this herb, as well as others in regard to headaches. Optimal treatment of headache requires use of channel guiding herbs to deliver the therapeutic effect of the herbs to the affected area. Qiang, Rhizoma Radix, Notopterygii, Chuanshang, Rhizoma ligustri, Chuanshang, Bai Zhi, Radix Angelica dahurica, Chaihu, Radix bupluri, and Gao Ben, Rhizoma ligustri, all treat headaches. According to Dr. Li Shou-Shan, the differences between these herbs are as follows. Qiang is more specific to occipital headaches. Chuanshang is more effective for headaches related to menstruation. Bai Zhi focuses on frontal headaches. Chaihu treats temporal or side headaches. And Gao Ben is best for vertex or top of the head headaches. Okay. Comparisons. Bensky and his team compares this herb with two others. The first one is Angelica pubescens radix, or duhuo. In ancient times, Qiang and Angelica pubescens radix duhuo were not differentiated. This is the key for the Shandong Ben Sojing. In fact, a passage in Divine Husband's Classic of Materia Medica, or the Shandong Ben Sojing, refers to one as just a different name for the other, duhuo, also named Qiang. The actions of these two herbs are indeed similar. Both expel wind dampness, eliminate painful obstruction, and alleviate pain. However, Qiang has a clear, strong aroma which travels best at the qi level, which makes it better for treating the more yang or superficial aspects of the body. It is also warmer and more drying than Angelica pubescens radix, or duhuo, which has a heavier aroma and more moderate warmth, travels more slowly, and more readily enters the blood level. Because this herb tends to move downward, it is better for lower limb and lower back wind dampness, which has penetrated deeper into the body. This combination is thus able to treat wind dampness at any level, above or below, and is better at relieving pain than is either herb by itself. Harm and benefit in the Materia Medica, the Bensao Hai Li, makes the following comparison. Qiang is more purple, masculine, and harsh in nature, and better able to regulate wandering wind. Angelica pubescens radix duhuo is more yellow, moderate, and better able to regulate lurking wind. There you go. So that's the comparison with duhuo, and explains why I had trouble finding Qiang in the Shandong Ben Sojing, which I forgot to mention. Shandong Ben Sojing is the oldest book. I mention it every time. A lot of our herbs are from it. It's the oldest book that we have in existence that it talks about individual herbs. So if an individual herb is in the Shandong Ben Sojing, it means it's amongst the oldest herbs around in Chinese medicine. Okay. Our next comparison is Ligustri Rhizoma, or Gao Ben. Qiang's powerful aroma rises to expel ambulatory wind in the muscles and exterior. It is best for neck and shoulder pain, but also for freeing the joints by venting pathogens from between the sinews and bones. Qiang and Ligustri Rhizoma, Gao Ben, both enter the governing vessel, but Qiang's tendency to move upward is stronger. While Ligustri Rhizoma Gao Ben can reach the vertex, it is better than Qiang for treating lower body disorders. Qiang's ability to enter the liver and kidney channels refers primarily to its effect at the sinew, liver, and bone kidney levels of the joints. Okay, that's a comparison with that. Let's talk about combinations now. So Bensky et al. Combines this herb with only one other. And that is one of my favorite herbs to pronounce, and I have no idea why I like pronouncing this herb. Subcategory radix, or feng feng. Subcategory. So there we go. Subcategory radix, feng feng, has thin qi and an ascending nature and is neither harsh nor drying. It is very effective for dispelling wind. Qiang is very drying and effective in dispersing an exterior cold, with its focus on the upper and more superficial aspects of the body. Combining these greater yang wind herbs provides a synergistic effect and is particularly helpful in dispelling wind, dispersing cold, and overcoming dampness to stop pain, as in externally contracted wind dampness. In addition, because both herbs ascend and disperse by nature, when used in a very small dosage, their combination can raise sunken middle qi. So that's our combination. And what are the contents of Qiang Huo? According to Bensky and his team, the contents of this herb include volatile oils, furanocoumarins, phenolic compounds, amino acids, phenethyl ferulate, and glycosides. Chen adds p-hydroxyphenethyl anisate, okay, and ferulic acid. Now, coumarins, I talked about coumarins in my phytopharmacognosy course. So coumarins consist of a pyrrone ring attached to a benzene ring. You don't have to worry about that. Coumarins have several potential health benefits, including anti-tumor, anti-HIV, human immunovirus, antibacterial, anticoagulant, central nervous system stimulant, anti-inflammatory, photochemotherapy, so both for light and chemotherapy, and anti-hyperlipidemic. So it actually helps control cholesterol in the blood. According to Chen and Chen, so let's get into the science. So that's the contents. Let's get into the science. According to Chen and Chen, the pharmacological effects of Qiang Huo include the following actions: antipyretic, which means it helps reduce fevers; analgesic, it helps reduce pain; and potentially beneficial to the cardiovascular system, especially arrhythmias, based on a mice study, mice. So, may help cardiovascular system, may not. Just because it helps in mice doesn't mean it's going to help in humans. Tong and his team adds anti-inflammatory, antiarrhythmic, anticoagulant, antibacterial, antioxidant, and anti-cancer effects on the brain, heart, digestive system, and respiratory system. So it adds a lot more effects. And that was from 2024. So Chen is 2004. So it's getting a little longer than 20 years old. Still awesome information. But Tong was this year, 2024. So it's brand spanking new, looking at a lot of the different functions of Qiang Huo. So, and there are several more that weren't discussed by Chen. They also discuss a clinical study. This is Chen also discussed a clinical study. Qiang Huo as part of the formula Jiawei Qiang Huo Tong, or 9 herb decoction with Notopterygium, was effective in 149 patients for treating common colds or influenza due to exterior wind cold syndrome. So I take this with a little bit of a grain of salt. So first of all, 149 patients is not a small study, but one of the results was 93% effective, which fine and dandy, that's great and all. But when a study from China says that, it means it's an older Chinese study, because that is not how studies should be summarized. And it's not an appropriate way to describe a study. And what happened was, I'd say about 10 or 20 years ago, all the Chinese studies, they realized, hey, we need to up our study game. And so they started really getting into how modern studies are done. And so anything before that time is going to have this, like it's 90% effective, it's 95% effective, that sort of thing, which is not appropriate. And then after that time, they don't say those things anymore. So it's a little bit of an older study. As soon as someone says 93% effective, I go, bull, because nothing's really that effective. And the way they defined efficacy is usually not well defined in these studies, which is weird. So the other reason why I don't like this study is it's a formula. So it doesn't actually tell us if Qiang Huo is helpful or not. It just says Qiang Huo with all these other herbs was helpful in this specific case. And the one thing I do like about this study is it's about exterior wind cold syndrome, which is not something we do in the West ever. We would have colds or influenza, but we would not define a cold or influenza as a wind cold syndrome. And I like that. I'd love to see more studies like that. So some positive negatives here on the study. In general, I don't know if it really helps support Qiang Huo's efficacy but it's an interesting study nonetheless. And I did do a Google Scholar search, which showed several animal studies, which I do not report here. I prefer reporting reviews, systematic reviews. Sometimes if it's a really good randomly controlled trial, I'll do that. But it has to be a clinical trial, not animal study. So, because I as far as a doctor, as we were trained to assess studies, if it's not in humans, it doesn't affect humans. It doesn't tell us what it does or doesn't do to humans. It has to be in humans. That's a clinical trial, and there were no clinical reviews about Qiang Huo's effects so we don't know. Okay, drug-herb interactions. Literature search did not find interactions between Qiang Huo and various cytochrome P450 isozymes or P glycoprotein. In other words, none of the major risk factors that we look at for drug-herb interactions showed anything. One paper did show a constituent of Qiang Huo, Notopterol, may inhibit cytochrome P450 2D6 in vitro, which means in glass. The study does not show clinical relevance and should not affect clinical decisions. So I assess drug-herb interactions all over the place. Cytochrome P450 interactions, I like thousands and thousands and thousands of them. When it's in vitro, I've seen a lot of these in vitro that play no role in clinical. Just because something does it in a test tube, which is technically what in vitro means, in glass, doesn't mean it will show the same effect when it's actually given to humans. And so until it's actually in humans, I would not say that this is an actual potential interaction. What this does do is say, okay, maybe we need to look at it in humans. But the other issue I don't like about this is it's a constituent of Notopterol. It only looked at one constituent of Qiang Huo. And Qiang Huo has thousands of constituents. And who's to say that other constituents may actually induce rather than inhibit this particular cytochrome P450. In other words, when you look at one constituent, that does not give you the full picture of what this herb may or may not do. So overall, I think this is useless. I'm mentioning it here for completeness, but if you ask my opinion, there are no known cytochrome P450 effects at this point that I found on research. And I would go as far looking at the American Herbal Product Association's Botanical Safety Handbook, which I love. It's a very well-researched book, puts this herb in interaction class A, herbs for which no clinically relevant interactions are expected. And I 100,000% agree with that at this point. Science is stepwise. Tomorrow they may say that shows all kinds of interactions with this herb. But as of today, I don't think there are any interactions to be concerned about with this herb. That doesn't mean there aren't concerns. So let's talk about some of those concerns. Bensky and his team note several concerns with Qiang Huo. Under the heading of cautions and contraindications, they say contraindicated for blood deficient painful obstruction, which echoes what we mentioned earlier with the blood deficient tetany. Under the heading of traditional contraindications, they quote harm and benefit in the Materia Medica, or the Ben Sao Hai Li, written in 1893. Both Qiang Huo and Angelica pubescentis radix Du Huo are wind herbs, important for expelling wind, dispersing cold, and eliminating dampness. Both, however, are forbidden for internal injury causing blood-deficient headache and generalized pain, resulting in chills and hot flushes, because these wind herbs can dry the blood. Chen and Chen have some concerns as well. Use of Qiang Huo is contraindicated for patients having febrile disorders, yin deficiency, or muscle aches and pain because of blood deficiency. It is also contraindicated for patients with Bijiang, or painful obstruction syndrome, who have red tongues with little or no tongue coating, which indicates yin deficiency, yin or blood deficiency. They also talk about overdosage of this herb. Overdoses of Qiang Huo may injure the stomach and cause nausea and vomiting. This may be eliminated by decreasing the dosage or by taking it with herbs that harmonize the stomach, such as Dazao, fructus jujube, and Xianjiang, that's Chinese dates, and Xianjiang Rhizoma zingiberis recens, which is fresh ginger. So you can take fresh ginger with it to prevent overdosage. Brandon Wiseman warns Qiang Huo is very warm and drying, used with care in yin blood depletion and an end in internally exuberant dryness heat. The American Herbal Products Association's Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. So concerns, especially around yin and blood deficiency, but generally not a ton of concerns with this herb, relatively safe. Just need to be careful of that dryness, which is why you don't want to do it in yin and blood deficiency, because those are dry kind of conditions. Okay. Summary. Today, we started with our discussion of arthritis and looked at both osteo and rheumatoid arthritis. Then we looked at another single Chinese herb, Qiāng, Notopterygii Rhizoma su Radix, or Notopterygium root. This herb is in the Chinese medical subcategory of warm, acrid herbs that release the exterior under the category of release the exterior herbs. It is helpful for certain types of colds and especially for alleviating pain and unblocking painful obstructions in many conditions, such as some types of arthritis. With this, we conclude another exploration of a very useful Chinese herb. Our next episode in 2 weeks, we'll be looking at another Chinese herbal formula, Shangju Yin, or mulberry leaf and chrysanthemum drink. This is from the formulas that release exterior wind heat subcategory of the formulas that release the exterior category. It is a useful formula for treating early stage colds with a cough. This is, if I have a bunch of formulas for colds, if I have 5 formulas for colds, this is definitely one of those 5 formulas. Very useful for colds with cough. Cough is the determining factor. As always, we will do our deep dive into this herb formula and look at its traditional uses and its preparation, interactions, and cautions. And as usual, we will be adding something a little different. It's going to be another interesting vacation to the exciting continent of herbs. Please join us. I'd just like to say thank you for listening very much up to this point. If you'd like this podcast, please do us a huge favor. Subscribe in your favorite podcast app, and we thank you for even considering doing that. And you can get this course, as well as many others, as continuing education units and National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And don't forget that 20% off with the code SH20OFF, or the course Treating Arthritis with Chinese Medicine. You can combine the two. You can get the course on Treating Arthritis with Chinese Medicine for 20% off. So that's a great combination. You can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. That's spurbsherbs, SPERBSHERBS.com. I have to pronounce that H for our Commonwealth friends. I used to teach in Australia, and whenever I'd say the word herbs, I'd always have a cheeky student who would say, "Excuse me, sir, do you mean herbs?" And I'd say, "Yes, I mean herbs." So, yes, the H is silent in the American version. And that concludes our podcast for the day. As usual, I have my bibliography. And thank you very much. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Timothy Dobbins,
Roger Campbell,